Cardiac arrest occurs when the heart suddenly stops beating. This can happen to anyone at any time for a variety of reasons. Even a seemingly healthy individual with no known heart problems can experience cardiac arrest. Approximately 80% of cardiac arrests occur at home in the presence of others. Most likely, if you are ever called upon to perform CPR, chances are it'll be on someone you know and love. Even in this day and age of medical miracles, only 12% of sudden cardiac arrest victims survive. Effective CPR administered early on can double or even triple the chance of survival. EMS responders in the U.S. are called to treat approximately 383,000 cases of sudden cardiac arrest per year outside of the hospital. That's about 1,000 cases per day. Today I'm going to give a small demonstration based on the current guidelines for administering CPR to infants under a year old. Although this is not a detailed training, I hope it will alert you to the importance of learning how to save a life with CPR. Many places offer free or low-cost training and certification. So I know firsthand how valuable this knowledge is to have. When my daughter was born, she had a very soft and narrow airway that often closed off and caused her to stop breathing, and this will eventually lead to cardiac arrest. After her birth, she was in the NICU for 10 days. I was required to learn infant CPR before I was allowed to bring her home. What I didn't know at the time was that I would be performing CPR on my own child in less than 1 week after bringing her home. Thankfully, I was not alone in the house, so a roommate was able to call 911 while I performed CPR. So if you find yourself in a situation and you're alone and have to perform CPR, you want to do it for a full 2 minutes before you stop and call 911, which is kind of against our normal instinct to do, but you need to perform CPR for a full 2 minutes and then stop and call 911. So when it's a loved one, especially a child in cardiac arrest, it's easy to panic and forget the steps. When you're properly trained, instinct often kicks in, and you'll be able to perform CPR effectively. I probably didn't do everything perfectly. Admittedly, I panicked. The EMS told me that even my imperfect attempt most likely saved her life. Infant CPR is performed slightly differently than how you would do on an adult or even an older child because they're smaller, their lungs are smaller. Infant CPR requires more control in very specific ways that compressions and rescue breathing should be performed. So there are 4 basic steps to remember. First, you want to check responsiveness. You obviously don't want to do CPR on a child that's alert and breathing. There's no need. You're going to do chest compressions, you're going to open the airway, and you're going to give 2 rescue breaths. So step 1, you're going to confirm unresponsiveness before performing CPR. So at that point, you would tap on the shoulder or shake gently or shout, "Are you okay?" to elicit a response. If there's no response, the child is blue or appears not to be breathing, you're going to begin CPR. If you're alone, you're going to continue immediately on to step 2. If you're not alone, you're going to call someone and yell to them to call 911. So you just say, "Call 911," someone call 911, and you continue what you're doing. You're going to lay the infant on his or her back on a firm flat surface, such as the floor, a table. You're going to begin chest compressions. So since the baby's smaller, you're only going to take 2 or 3 fingers, not a whole hand, not a full palm, and you're going to go down to the center of their chest, slightly down from the nipples, and then you're going to compress about 1.5 inches. Let's see here. So gently you want to do this. You want to do 30 compressions, and you want to do it at a rate of about 100 compressions per minute, so it's very rapid, okay? So after you've done the 30 compressions, you're going to check the airway. So what you're going to do is you're going to place your hand on the forehead of the child and under the chin. You're going to gently tip. You don't want to extend it too far and hurt the neck, but you want to ensure that the airway is open. Then if the baby is not breathing or breathing very irregularly, you're going to cover the child's nose and mouth completely with your mouth. So you're going to make a seal. And unfortunately with this baby doll, it doesn't quite make a complete seal, but you're going to put your mouth around the nose and mouth like this and do 2 short, about a second long breaths. And then you should be able to see the chest rise and fall with each breath. You don't want to do too long or too hard because you'll overexpand the lungs, which obviously can injure the infant. Let's see, you're going to continue with the cycle of the 30 compressions and 2 breaths until help arrives. If you're alone, you're going to repeat the cycle for 2 minutes and then quickly call 911 and then resume the cycles until the EMS arrives. If someone else is there, you can switch off with one rescuer when one becomes fatigued, which is usually what happens when you have to perform it for a long time because it is a tedious task there. I'm hoping that this small demonstration has illustrated the importance of learning CPR and inspired you to get further training. I pray that you will never be faced with having to utilize this training, but if the need arises, you will be fully prepared. Remember, the life you save with CPR may very well be someone near and dear to you, and even an attempt at CPR can make the difference between life and death. So again, just to go back over it, you're going to check responsiveness. If somebody else is in the house, you're going to ask them to call 911. Then you're going to begin the chest compressions with 2 or 3 fingers in the center of the chest. You're going to do 30 compressions at a fairly rapid rate of about 100 per minute. Then at that point, you're going to open the airway by placing the hand on the forehead, lifting the chin. Once the airway is opened, you're going to wrap your mouth around the entire nose and mouth of the baby. Do 2 short, gentle 1 second long breaths like this. Look for the chest to rise and fall. And then you're going to do that for 2 minutes. If you're on your own, then call 911. If somebody else is there, you're going to continue doing this until EMS arrives.
So you could stop and make a call?
You can stop and make a call, but you want to do 2 minutes of CPR. So at least 2 to 3 rounds before you call. So which is against our instincts, but it's in the child's, well, anybody's best interest if you're doing CPR. That's it.